So can someone be a narcissist without realizing it because of what they've gone through in childhood? Is that like, is it out of their control? Is it kind of like,
That's why I call it a coping mechanism, because it comes out of, learning to function in an environment with unmet needs. And that can lead to a lot of psychological issues, whether it's, substance use or behavioral issues and disorders, or narcissism as a defense is sometimes how this individual learns to get their needs met. That's why narcissists at times, people will say, oh, they were so charming and they were the best person in the world. They put me on a pedestal. And then they started with the behavior that was more abusive or coercive. And so I think that's why it can feel traumatic in a relationship. And I think if we look at it from that early trauma, we're able to understand that this person may not be aware consciously that they are doing this, or they've been functioning like this for so long, it's been normalized somehow in their environment because of those wounds or inner core beliefs. So it's a lot more complicated than it is not for us to use it as like a blanket term when we don't like someone's behavior, or we feel that someone is, maybe, expressing more grandiosity. I would say it's important that we assess it appropriately. That's why when I hear people throw the term around, I think, we may not be that, but let's, especially in therapy, let's see if that's really the case. Let's assess appropriately, which is why it's important to work with a mental health professional who can appropriately diagnose and do that, to be able to figure out how to address it and how to move forward.